I want to start with something that almost never gets said about varicose veins. And I want to say it clearly, the way I say it when a patient sits down in my clinic and tells me she has been resting her legs because she thought that was protecting them. Resting is making it worse. I know that feels counterintuitive. I know it feels like the right thing to do when something looks inflamed and raised and uncomfortable. But varicose veins are not an inflammation problem, and they are not a genetics problem. They are a mechanical problem, and the mechanism driving them gets worse every single hour your legs are still. Here is what is actually happening inside your veins. Every vein in your leg has a series of one-way valves, tiny flaps of connective tissue that open to let blood move upward toward your heart, then snap shut immediately to stop it from falling back down. When those valves weaken, from declining estrogen, from chronic venous pressure, from low-grade internal inflammation, blood pools in the segment of vein directly below the faulty valve. That pooled blood creates what we call hydrostatic pressure, which is simply the downward weight of that blood column pressing outward against the vein wall. That outward pressure is what stretches the vein into the raised, ropey bulge you have been pressing on at night. But here is the part that changes everything. Your calf muscle, specifically the gastrocnemius and soleus, is your body's second heart for the lower limbs. Every single time your calf contracts, it physically squeezes the surrounding veins and pushes blood upward through the valve system. Every time your calf is inactive, that pump stops completely. Pressure builds below every weakened valve and the deterioration accelerates. So when you rest your legs to protect them, you are switching off the only pump your venous system has. And the pressure that is stretching and damaging those vein walls builds with every minute of stillness. I want you to think of it like a series of escalators carrying blood upward toward your heart. Each valve is one mechanical step in that escalator. When the escalators are running, your calves contracting, your ankles moving, blood rises efficiently and pressure stays low. When the escalators stop, blood piles up at every landing, the walls bow outward from the weight, and the steps begin to buckle. The varicose vein is that bowed wall, and you cannot fix a bowed wall by resting it. You have to get the escalator moving again. And that is precisely what the 5 movements in this video are designed to do. Root factor 1, calf muscle pump inactivation. The first factor is the most foundational, and it is the one that begins deteriorating from the moment you sit down in the morning and does not recover until you deliberately intervene. You might be thinking, I am on my feet a lot, I walk regularly, surely my calf muscles are getting enough activation. Walking helps, but it is not enough to counteract the specific pressure that builds during every period of stillness. And most women have far more stillness in their day than they realize. Here is the mechanism. The venous pressure in your lower legs is not constant. It is directly tied to what your calf muscles are doing at any given moment. When your calf contracts, venous pressure in the lower leg drops significantly as blood is pushed upward. When you are still, pressure rises. Vascular physiology data published in the European Journal of Vascular and Endovascular Surgery measured venous pressure in the lower leg at 90 millimeters of mercury after just 30 minutes of quiet standing, nearly 3 times the normal resting pressure. 90 millimeters of mercury, from simply standing without moving. That pressure is being applied against already weakened vein walls and already compromised valves every single day for hours at a time. This is why compression stockings feel helpful, but do not fix the underlying problem. They apply counterpressure from the outside, which temporarily reduces the ballooning of the vein wall, like squeezing the bowed escalator wall back into shape with your hands. But the moment you remove the stocking, the pressure returns, because the pump was never reactivated. The movement solution is a calf raise, and the precision of how you perform it matters significantly. Stand behind a chair or at a kitchen counter for balance. Feet hip-width apart. Rise slowly onto the balls of both feet over exactly 3 seconds. Hold at the top for 1 full second. This is the moment of maximum venous compression and upward push. Lower over 3 seconds. That is 1 repetition. Perform 20 repetitions every 45 minutes of sitting or standing throughout the day. Set a timer if you need to. 20 repetitions takes 2 minutes. It requires no equipment, no space, and no change of clothing. The second factor is one that is happening inside the vein wall itself, driven by something you are eating every day. And it is the reason the valves are failing faster than they should. Root factor 2, venous valve inflammation from dietary triggers. The second factor surprises most women because it connects the food on your plate directly to the structural integrity of something as precise as a venous valve. And once you understand this connection, you will never look at your meals the same way. You might be thinking, I have heard that diet affects circulation generally, but my diet is not that bad. This is not about a bad diet in general terms. This is about a specific biochemical pathway that affects the connective tissue of venous valves in particular, and it is active at levels of inflammatory exposure that most women would consider moderate or even healthy. Here is the pathway. The one-way valves inside your veins are made of collagen-rich connective tissue. Like all connective tissue after menopause, they are vulnerable to a process called venous valve endothelial dysfunction, which simply means inflammatory damage to the cells lining the inside of the valve leaflets that causes them to stiffen, swell, and lose the precise closure that prevents backflow. The primary trigger for this inflammation is post-meal blood glucose spikes, not just from sugar, but from refined carbohydrates, processed breakfast foods, and high-sodium meals that create simultaneous glycemic and osmotic stress on vascular tissue. Research published in the journal Phlebology found that women with progressive chronic venous insufficiency had significantly elevated dietary inflammatory markers compared to age-matched controls, a correlation that held even after controlling for body weight and physical activity levels. This is why varicose vein symptoms often worsen in the afternoon. The cumulative inflammatory load from 2 meals has already been building since breakfast. Topical treatments and elevating the legs provide temporary relief, but the inflammatory signal is being resent with every meal, and the valves continue to deteriorate. The kitchen solution is 1 tablespoon of raw, unfiltered apple cider vinegar dissolved in 200 milliliters of water, consumed 10 minutes before your 2 largest meals of the day. Apple cider vinegar reduces post-meal blood glucose response by slowing gastric emptying and improving insulin sensitivity at the meal level, directly reducing the glycemic inflammatory signal reaching your venous valve tissue. 1 tablespoon, 200 milliliters of water, before lunch and before dinner, every day. If this level of vascular detail is new to you and you have not subscribed yet, please do it now. Because every video on this channel goes this deep, and the next 3 factors are more structurally important than anything we have covered so far. Root factor 3, nighttime leg position and venous stagnation. The third factor operates for 8 hours every night while you are completely unaware of it. And it means that your veins may be starting every single day already under elevated pressure before you have taken a single step. You might be thinking, I rest my legs at night, surely that is helping. Resting is not the same as draining. And the position in which most women sleep is actively working against venous return in ways that are entirely correctable. Here is what happens. During sleep, the calf muscle pump is completely inactive. Venous return from the legs relies entirely on gravitational positioning and the gentle pressure variation created by breathing. When the legs are flat, venous return is neutral at best. The blood must still travel horizontally before rising to the heart, and the valves carry the full burden of preventing backflow with no muscular assistance. When the knees are bent or the ankles are crossed during sleep, both extremely common positions, the popliteal vein, which simply means the major vein running behind the knee, is partially compressed, creating a localized back pressure point that elevates venous pressure in the entire lower leg throughout the night. A study in the journal Phlebology documented that lower limb venous pressure during overnight rest was measurably higher in patients who slept with flexed knees compared to those with legs fully extended and elevated, a difference that compounded over years into significantly faster valve deterioration. This is why so many women with varicose veins report that the heaviness and aching are worst first thing in the morning, not after a day of activity, but before it. 8 hours of gravitational stagnation and popliteal compression has left the venous system starting each day in a pressure deficit. The solution costs nothing and requires only 1 change to your sleep setup. Place a firm folded pillow or a tightly rolled blanket specifically under your calves, not under your knees. The calves must be elevated 15 to 20 centimeters above the level of your heart, with the knees remaining gently extended rather than flexed. This single positional change allows 8 hours of passive gravitational venous drainage every night, reducing the pressure burden your valves face each morning before any movement has occurred. The fourth factor goes deeper than position or diet. It is about the structural integrity of the vein wall itself, and it explains why varicose veins accelerate so sharply after 50. Root factor 4, connective tissue weakness in the vein wall. The fourth factor is the structural one, and understanding it will explain something you may have already noticed, that your varicose veins are progressing faster now than they were 5 years ago, even if nothing else in your life has obviously changed. You might be thinking weakening vein walls sound like something only a surgeon can address. I want to show you why that is not entirely true. Because the nutritional support for vein wall connective tissue is remarkably specific and remarkably accessible. Here's the mechanism. The wall of every vein is composed of 3 layers. The critical middle layer is called the tunica media, which simply means the muscular and elastic middle layer that gives the vein its structural strength and its ability to contract and resist outward pressure. The tunica media is rich in elastin and collagen, the same structural proteins that maintain skin firmness. After menopause, declining estrogen directly reduces elastin production in vascular tissue, making the tunica media thinner, less elastic, and far more vulnerable to outward stretching under normal venous pressure. A 2020 study in the Journal of Vascular Surgery measured significantly thinner tunica media and lower elastin fiber density in postmenopausal women compared to premenopausal controls of similar vascular health, providing a direct structural explanation for why varicose vein progression accelerates so sharply after 50. The vein wall simply cannot hold its shape under the same pressure it managed 10 years ago. This is why sclerotherapy, the injection treatment that collapses varicose veins, has a high recurrence rate in postmenopausal women. The structural weakness in the surrounding vein wall tissue means that adjacent veins deteriorate even after the treated vein is closed. You are collapsing individual bowed walls without addressing the reason all the walls are bowing. The dietary solution targets a flavonoid compound called rutin, which simply means a plant-based molecule that has been clinically shown to strengthen capillary and vein wall connective tissue by supporting collagen cross-linking in the vascular media. Eat 1 medium apple with the skin every single day. Rutin is concentrated in the apple skin and is destroyed by peeling. Add 1 cup of buckwheat tea daily. Buckwheat is the richest dietary source of rutin, containing approximately 36 milligrams per cup. Together, these 2 foods deliver a daily rutin dose shown in European phlebology research to measurably improve vein wall tensile strength within 8 to 12 weeks. The 5th and final factor is the one happening farthest from your legs, and it is the reason your leg veins cannot drain properly no matter how much you move them. Root factor 5, abdominal pressure and pelvic venous obstruction. The 5th factor is the one that almost no conversation about varicose veins ever reaches, because it is happening entirely above the legs, and most women have never been told that their leg veins drain through their pelvis before they can reach their heart. You might be thinking, my legs and my abdomen are separate systems. They are connected by the venous drainage pathway in a way that directly determines how much pressure your leg veins carry every single day. Here's the mechanism. The venous blood returning from both legs must pass through 2 large vessels called the iliac veins, which simply means the paired major veins in the pelvis that collect blood from the legs and feed it into the inferior vena cava toward the heart. When intra-abdominal pressure is chronically elevated, from habitual breath holding, poor diaphragmatic engagement, chronic constipation, or excess abdominal weight, it creates persistent external compression on these iliac veins. This partial compression acts as an upstream blockage that elevates back pressure throughout the entire leg venous system, regardless of how actively the calf muscle pump is working. A study published in the journal Cardiovascular and Interventional Radiology documented that elevated intra-abdominal pressure increased lower limb venous pressure by an average of 23% in women with chronic venous insufficiency, independent of leg position or activity level. 23% of additional pressure constantly from a source entirely above the knee. This is why some women perform every correct leg exercise, wear compression stockings, and elevate their legs faithfully, and still see minimal improvement. The upstream blockage is maintaining the pressure regardless of what the downstream pump is doing. It is like trying to drain a bath with the plug still partially in. The solution is diaphragmatic breathing practice, 5 minutes every morning before getting out of bed. Lie flat on your back with both hands resting on your lower belly. Inhale slowly for 4 counts, allowing the belly to rise fully while the chest stays relatively still. Hold for 2 counts. Exhale fully for 6 counts, drawing the belly gently toward the spine. Perform this for 5 minutes, approximately 15 to 18 full breath cycles. The downward movement of the diaphragm during each inhalation mechanically massages the pelvic veins and iliac vessels, reduces intra-abdominal pressure, and creates the negative thoracic pressure that actively pulls venous blood upward from the legs into the chest. This is the one intervention that addresses the venous system from above, and it costs nothing. Practical protocol. Now let me give you the complete 4-week system. These are not 5 separate tips. They are 5 interlocking mechanisms that only reach their full effect when they operate together. The order of the weeks matters. Week 1, pump reactivation and pressure reduction. Every morning this week, before you get out of bed, perform 5 minutes of diaphragmatic breathing. 4 counts in, 2 counts hold, 6 counts out, with both hands on your lower belly to confirm the belly is rising and falling rather than the chest. Then perform 30 slow ankle circles in each direction while still lying flat. This takes 7 minutes total and begins the day with venous drainage rather than venous stagnation. Every 45 minutes throughout the day, perform 20 calf raises using the precise 3-second up, 1-second hold, 3-second down tempo. Set a timer on your phone. This is non-negotiable. 10 minutes before lunch and 10 minutes before dinner, drink 1 tablespoon of raw apple cider vinegar in 200 milliliters of water. Every evening, set up your sleep elevation before you get into bed. Firm folded pillow or rolled blanket positioned under the calves, not the knees, raising the calves 15 to 20 centimeters above heart level. Week 2, vein wall nutrition and overnight drainage continue all week 1 practices. Add the daily root and foods this week: 1 medium apple with the skin at any point in the day and 1 cup of buckwheat tea. Steep 2 tablespoons of raw buckwheat groats in 250 milliliters of boiling water for 10 minutes, strain, and drink warm. This can be your morning or afternoon drink. Add the bonus technique 2 evenings this week. Lie on your back with both legs extended straight up the wall at a 90-degree angle. In this position, perform 20 slow diaphragmatic breaths, 4 counts in, 6 counts out, while simultaneously performing 20 slow ankle flex and point cycles. Point the toes down toward the floor, then flex the foot back toward the shin, 1 per breath. Hold the position for 8 minutes total. This combines passive gravitational drainage, active calf pump stimulation, and diaphragmatic venous pull simultaneously. 3 drainage mechanisms in 1 position. Week 3, full movement circuit and anti-inflammatory nutrition continue all week 1 and week 2 practices. This week you add the complete 5-movement daily leg circuit, performed as 1 connected sequence every morning after your diaphragmatic breathing. The sequence is 20 calf raises, 30 ankle circles each direction, 20 standing knee lifts bringing each knee to hip height alternately, 20 wall-supported leg swings forward and back on each leg, and 5 minutes of the inverted wall position with ankle pumps. Perform this circuit in the morning and a shortened version, calf raises and ankle circles only, in the evening before bed. Also this week, add a cold water rinse to your morning shower. After washing, direct cool to cold water at both lower legs from ankle to knee for 30 seconds. Cold water application causes immediate vasoconstriction followed by reactive vasodilation, which simply means the blood vessels contract then expand, creating a pumping effect in the superficial vascular network that supports venous tone in the vessel walls. Week 4, integration, measurement, and full system. This is the week the protocol becomes a permanent system. All previous practices continue without exception. Add the bonus drainage technique every evening this week, not just twice. At the end of week 4, assess 3 specific markers: the degree of visible vein prominence compared to week 1, photograph in the same light at the same time of morning, the level of leg heaviness and aching at the end of the day on a scale of 1 to 10, and the skin texture and discoloration around the affected veins. For most women, all 3 markers show measurable improvement by week 4, and the evening heaviness shows improvement as early as week 2. This is not a routine you do for a month and stop. This is a vascular maintenance system, the same system your body was designed to use every day when it was moving the way it was built to move. Now I want to speak to you specifically, because the clinical priority inside this protocol changes meaningfully depending on where you are in the hormonal and vascular timeline, and I want to make sure you are focusing on the right element first. If you are in your 40s, your venous valve connective tissue is beginning to lose estrogen support, but your vein wall still has significant structural resilience. The most impactful intervention for you right now is the calf raise protocol and the rutin nutrition. Begin building the vascular wall strength now before the hormonal loss accelerates the deterioration. If you are in your 50s, you are in the window of fastest venous valve deterioration. Estrogen has dropped significantly. The tunica media is thinning, and every period of sitting or standing still is applying pressure to walls that are less equipped to resist it than they were 3 years ago. Your clinical priority is the abdominal pressure factor, the diaphragmatic breathing practice, because the upstream pelvic blockage is multiplying the effect of every other factor simultaneously. If you are in your 60s, the overnight drainage position and the bonus inverted drainage technique become your highest priority interventions. After a decade of compounding valve deterioration and reduced vascular tone, passive gravitational drainage during sleep and the evening wall position are doing work that movement alone can no longer fully compensate for. Drop your age in the comments right now. Not for me, for yourself, so you can come back to this video and know exactly which section to return to first. Let me bring this together clearly before we close. There are 5 root factors driving your varicose vein progression, and all 5 can be directly addressed with movement, position, and kitchen ingredients that cost almost nothing. Factor 1 is calf muscle pump inactivation, solved by 20 precise calf raises every 45 minutes throughout the day. Factor 2 is venous valve inflammation from dietary triggers, solved by 1 tablespoon of raw apple cider vinegar in water before your 2 main meals daily. Factor 3 is nighttime venous stagnation from poor leg position, solved by elevating the calves 15 to 20 centimeters above heart level on a firm pillow every night. Factor 4 is connective tissue weakness in the vein wall, solved by 1 apple with the skin and 1 cup of buckwheat tea every single day. Factor 5 is abdominal pressure creating upstream pelvic venous obstruction, solved by 5 minutes of diaphragmatic breathing every morning before getting out of bed. Together with the evening inverted drainage technique, these 5 interventions form a complete mechanical and nutritional system that addresses venous pressure from above, below, and inside the vein wall, simultaneously every day. 1 critical clinical warning before we close. If you notice sudden swelling in one leg only, skin that is warm, red, or tender to the touch along the path of a vein, or a hard cord-like area that appears quickly in the leg, please seek medical evaluation immediately. These can be signs of deep vein thrombosis, which simply means a blood clot in the deep venous system, and this requires urgent clinical assessment before any movement protocol is appropriate. This protocol supports the body's natural venous return mechanisms. It does not replace vascular assessment, and if you have been diagnosed with any clotting disorder, venous ulceration, or advanced venous insufficiency, please consult your physician before beginning any compression or inversion component of this protocol. No vascular clinic will give you a 28-minute explanation of the 5 mechanical reasons your veins are deteriorating, because there is no procedure to book at the end of that conversation, and no billing code for buckwheat tea and a calf raise. This channel exists to give women over 50 the clinical truth about their vascular and structural health, in precise, actionable language, with nothing to buy and no appointment required. Your varicose veins are not a cosmetic flaw. They are a pressure signal from a pump system that needs to be reactivated. And now you know exactly how to do that. I am Dr. Elena Voss, with 15 years of clinical practice, and I will see you in the next video. If you know a woman who is quietly pressing on her veins at night and wondering if anything can actually help, please share this video with her right now. She deserves these answers. And if you have not subscribed yet, do it for her as much as for yourself. Because what is coming on this channel will keep building on everything you learned today, one system at a time.